Good morning, members of the press. Thank you for being with us here today. My name is Linda Roman. I'm the director of health policy for the Oregon Latino Health Coalition and the Oregon Health Equity Alliance. OHE is a collective of 40 regional and state partners who work to improve the health and well-being of all Oregonians. Since 2009, our organizations have been working to address historic and persistent health inequities facing our working families, elders, and children. We are proud to release the Mend the Gap report today, outlining 10 policy recommendations, several of which have been carefully maturing through legislative work groups, broad stakeholder engagements, and bipartisan support. We have worked at the local level with the development of CCOs, and we are consistently engaged with working with health industry partners and impacted community members. We are here today because of two intersected beliefs. First, that we all pay the price for poor health. Poor health undermines our economy and places a financial and emotional toll on families and small businesses. Poor health and being uninsured means you're more likely to experience needless suffering, pain, and death in some cases. Oregon can and should do better. Number two, access to care is the cornerstone and well-being for working families, and affordable health insurance is critical for the future prosperity of all 36 counties in Oregon. So thank you for being here. I'd like to introduce Reverend Joseph Santos Lyons, the Executive Director of APANO.
Good morning, my name is Joseph Santos Lyons. I'm the Executive Director for the Asian Pacific American Network of Oregon, or APANO. It's good to see you all today. The Oregon Health Equity Alliance, or OHE, and dozens of partners, including the Oregon Nurses Association, the Lynn Benton and Southern Oregon Health Equity Alliances, and the Oregon Primary Care Association, present to you our new report, Mend the Gap, Why Full Coverage Makes Sense for Oregon. The Oregon Health Equity Alliance Mend the Gap report details the gaps in coverage and the disproportionate impacts on rural Oregonians, communities of color, immigrants, refugees, women, lesbian, gay, bisexual, transgender persons, and persons with chronic conditions. This report recognizes that while having health insurance is no guarantee of actually receiving care, it is a primary driver of good health outcomes. Despite strides in health reform here in Oregon, 383,000 Oregonians, nearly 1 in 10 in our state, remain uninsured, and this is unacceptable. Urgent work is needed to ensure good health for Oregon's changing racial and cultural demographics. State leaders have pragmatic and bipartisan policy options to mend the gaps and ensure every Oregonian in every county in this state have affordable access to care. I want to share a couple of the key findings. Large swaths of rural Oregon suffer from poor access to health services, according to the Oregon Office of Rural Health. Residents in these areas often have trouble finding a primary care provider within a reasonable distance to their home. Oregonians in these areas have high unmet health care needs and suffer comparatively high rates of preventable hospitalizations, mortality, and low birth weight. 18% of communities of color lack health insurance, and many due to government exclusions based on citizenship, compared to only 8% of whites. Low-income Oregonians who are not eligible for Medicaid, who are above 138% of the federal poverty line, up to 200%, are more than twice as likely to be uninsured here in Oregon. LGBTQ adults are uninsured at a rate of 23%, and it is also notable that a recent study found that 22% of transgender Oregonians have reported being refused medical care. And lastly, immigrants, many of whom lived in mixed-status families where some members are U.S. citizens, face a range of exclusions. These include the 5-year bar, the 5-year waiting period for legal permanent residence, the Compact of Free Association Pacific Islanders, who face a lifetime bar and ban from Medicaid, and undocumented children and undocumented adults. The uninsured and underinsured are more likely to end up in emergency rooms and hospitalized for preventable illnesses, adding costs to the healthcare system, the state budget, and to each of us. This impact ripples out into our economy when illness means children attain lower educational levels and workers are less productive. Oregon's future and economic future depends on the health of everyone. Affordable, comprehensive health care coverage makes sense for families and for the state of Oregon. When families have access to affordable care, they're able to devote more of their resources to meeting other critical needs. Having to spend less on health care helps families to get ahead. I'm an Oregonian. I've lived here for my entire life, and we're really supportive of seeing this Mend the Gap report get out into our public sphere and making sure all electeds and community leaders are aware of the issues facing Oregonians. With that, I'd like to introduce Carla Castaneda, who has a personal story to tell.
Hi everyone, my name is Carla Castaneda. I'm currently a student at Mount Hood Community College, and I have lived in Oregon for most of my life. I migrated to the United States when I was 4 years old. I had asthma and health insurance was not available to me because I'm undocumented. I remember feeling like I was different, like I didn't deserve to be healthy, to be taken care of. Free clinics helped, but the time wasn't enough. My asthma attacks helped me get into a doctor, but I had to be really sick in order to get that help. My life didn't seem important. We value children's health, so why wasn't mine valued? My dental health was non-existent. I was never able to see a dentist, unless the school offered it, but that was only 10 minutes, and just to check if I had a cavity, and then referred to a clinic that had a long waiting period. Oregon values kids. It is not an Oregon value to decide which kid gets health insurance and which one doesn't. All children deserve to be healthy. They play in the parks and attend schools. Their future is our future. I'm an Oregonian. I lived here since I was 4 years old. I'm 20 now. I'm undocumented, and all children matter. Health care for all children needs to become a reality. Jeremiah.
Good morning. My name is Jeremiah Rigsby. I represent Care Oregon, and Care Oregon is the parent company for two CCOs, Jackson Care Connect down in Jackson County and Columbia Pacific CCO up in Clatsop, Columbia, and Tillamook counties. We're also a big part of HealthShare in the metro area. We have about 160,000 members in the HealthShare structure. Due to the nature of our membership, we are in full support of this Mend the Gap report. About 130,000 of our adults, maybe 1 in 4 of them, are from communities of color, and that's with the data that we know. About 11% of our membership, we have no idea what race or ethnicity they are. As CCOs, we are only now coming to grips with some of the disparities that are present within communities of color, and we are trying to wrap our heads around what we need to do to address those disparities. This Mend the Gap report that OHE has put out goes a long way to figuring out and moving forward work being done to address health disparities within community of color, to really recognize that there are some differences and to figure out how to move forward in addressing those differences. As one of the biggest providers of the Oregon Health Plan in the state, Care Oregon is fundamentally committed to addressing those disparities. We believe that this is what CCOs are created to do. And if 1 in 4 of our members are from community of color, from what we know right now, we think that actually that population might be much higher. We believe that there is work to do, and this is the first step in doing that work. Thank you.
Thank you, Jeremiah and Carla, for sharing your story. Thank you for being with us today. We invite you to join us today at noon for our rally that's happening on the Capitol steps, where more stories will be highlighted of impacted Oregonians. Joseph and myself are happy to answer any questions that you may have.
I think you said, if I wrote this down right, 23% of the LGBTQ uninsured. Mm-hmm. Could you tell us a little bit more about what some of the factors are in that number?
Yeah, I mean, some of the same factors that affect communities of color, which is poverty rates, as well as access to meaningful care, where someone has a trusted relationship with their provider. So those are some of the key sort of reasons why folks either don't get care because they can't afford it, or because they can't find the right kind of care that they need.
So, I mean, is that particular community experience higher poverty rates, or what? I mean, why would that be sort of higher than the general population?
Yeah, that's correct. The LGBTQ community does experience higher poverty rates than the average Oregonian.
And go ahead.
Is there any legislative or ballot measure target for the healthcare for all Oregon children?
At this time, there is not.
What are some of the actions? I mean, are there specific actions you'd like to see the legislature take, particularly in the 2016 session?
Yeah, definitely. We do have the basic health plan. We would like to ask for a blueprint from the Center for Medicaid Services. That is one bill that will be coming up in 2016. We also have a COFA premium assistance program that we would like to implement. That's also going to be, that just had a really great stakeholder engagement that just happened, and they just reported yesterday to this House Healthcare. We also are working incrementally to introduce Cover All Kids for 2017. It's something that we're not introducing for 2016, but we will do plan to introduce that in 2017.
And just to clarify, Chris, there are about 17,600 children who are left out of the state's Medicaid program because of their documentation status, and we don't believe that that speaks to the best of who we are as a state, and we want to help Oregon keep its promise to all of its children, which to us means that in 2017 we will be working with full diligence and the full support of our health industry partners and our community partners to leverage this significant policy change to make sure that Oregon keeps its promise to all of its children. And so in 2017 we will bring a full bill to bear to remedy this exclusion.
Have you worked to get the support of the Hospital Association or some of those players?
Thank you. We are in discussions with a great many of our health industry folks who are standing ready to be supportive of our work moving forward and to be able to secure legislative support to make this happen. We believe that that means not only a statewide grassroots campaign, but a health industry campaign where our health partners who are missing out on 20,000 members have a right to be at that table and to help inform and shape that policy discussion.
How many people were helped by the DREAM Act or the in-state tuition program that did make it through the 2013 legislature?
We don't have those exact numbers.
So the DREAM Act doesn't actually guarantee health care to
No, I know. I mean,
Yeah.
it's like it's a similar, it was a benefit that, or like something that was won for this same, children who grew up in Oregon, but.
That's right. The DREAM Act has really created more educational opportunities for some of these children that we're discussing today. But because that's a fairly new remedy, we don't yet have some of the specific numbers to share with you, except that.
No.
We do know that there's 16,000 Oregonians who currently have a DACA status, which stands for Deferred Action for Childhood Arrivals, who could possibly fall within that age range. The children that we're talking about, these are children under the age of 19, so many of those people who would have been eligible for the DREAM Act or tuition equity are too old now.
I think what we also know is that kids can't be ready to learn if they're not healthy. If we're suffering from untreated diabetes, if we haven't had our primary health care needs met, it's going to be really difficult for us to be ready to learn. If we don't get prenatal care, if we don't get early childhood care, then we are at a disadvantage when it comes to being ready to learn, when it's time for us to become fully productive citizens in this community. And so a predicate of readiness to learn is being healthy enough to learn.
I'm sorry, would you mind introducing yourself?
Thank you. I'm Alberto Moreno. I'm the Executive Director with the Oregon Latino Health Coalition.
Do you have any other questions?
Also at noon today, Senator Arnie Roblin and the chair of the Senate Health Committee, Lori Marnus Anderson, will be speaking at the rally, and so that'll be at noon on the Capitol steps, rain or shine.
Thank you
Great.
very much.
Thank you.
Thanks.